Does scoliosis affect balance? Scoliosis causes a number of effects, and although it's a spinal condition, its effects can be felt throughout the entire body. Scoliosis induces a lot of uneven forces to the body that can shift its center of gravity, which can disrupt balance. Scoliosis also causes a number of postural changes and other effects to the body, which potentially could affect balance as well. And we know because the scoliosis causes uneven forces that disrupt the overall body symmetry, postural changes can occur. And when we look at postural changes, we look at uneven shoulders, uneven hips, or some of the earliest signs of scoliosis in children. But as the curve gets bigger, these postural changes get more and more obvious. And we look at postural changes, it can not only be uneven shoulders, uneven hips, but it can be where the head is appearing to tilt or off center of the torso. We can see that the eye line, it tends to be uneven. We can see uneven shoulder blades. We can see development of a ribcage arch. We can see the arms that hang at different lengths or appear to hang differently next to the body. And as a result of all these things, it can lead to something called proprioception imbalance because the body is not in symmetry. The body tends to lose or affect the way it knows it's where it is in space. And this lack of proprioception can lead to balance changes. Additional symptoms associated with scoliosis that disrupt balance and coordination and gait could be what we call a prominent lean. As the curve tends to progress, they tend to shift. And we call this a coronal imbalance. And they can shift to the left or they can shift to the right. And this shifting leads to this unstable environment where the torso is severely shifted relative to the pelvis and feet. Also, as curves progress, they can end up with a forward bend position. And this forward bend position can also cause an ability or a lack of ability to have stability and affect balance and coordination. Also, scoliosis in the adult stage can become compressive. And when it becomes compressive, it can become painful, which can involve the muscles of the back. It can involve nerve pain. It can involve compression of the nerves exiting into the legs, which can lead to weakness, which can also affect balance and coordination. And we know scoliosis pain is the main symptom of adult scoliosis. And we also know scoliosis can lead to something called muscular imbalance, which is also something that could affect balance. And muscular imbalance is typically a reaction that occurs because the spine is not in a symmetrical position, meaning there's a curve occurring, and as the curve's occurring and getting larger and getting bigger, the muscles are reacting to an asymmetrical spine. And as they react, some muscles become more worked and other muscles become less worked. And this result of lack of stability or lack of symmetry and these muscles responding, it can lead to this muscle imbalance, which prevents the body from moving symmetrically from one side to the other. And this can also lead to this effect of balance and stability. As the curve also gets larger, we also develop something called spinal rigidity. And spinal rigidity is where the spine can no longer move symmetrically from side to side. It's kind of like one elbow can move like this and the other one gets stiffer and can only move that way. And what we find with patients with scoliosis is that it's easier for them to move into the concavity, but much more difficult to move into the convexity. This can also affect balance and movement because this promotes a muscular imbalance, which can also continue to affect balance and coordination. So this idea of the spine as it gets bigger and more curvature has many different ways of affecting balance and coordination. So a patient with scoliosis that's experiencing these balance concerns and these proprioception concerns, what are some things that can be done? Well, by far the easiest thing to do is start to address the scoliosis itself, because when you address the size of curve, you're addressing what's causing the things from occurring. All the other things are symptoms of scoliosis: muscle imbalance, coordination, postural changes. These are pain. These are all symptoms of scoliosis. So treating the symptoms of scoliosis is what most patients end up doing. But what I normally would recommend is treating what's causing the symptoms, which is the curve itself. And this is really addressing the scoliosis on a structural level, meaning making the curve smaller. By making the curve smaller, you're reducing the expression of the scoliosis and all its symptoms that are associated with it. Since we know scoliosis is a progressive condition, it tends to worsen, and as it worsens, so do the effects. Many patients, when they have these effects, they go seek treatment, but they're only seeking treatment for the symptoms of scoliosis. So therefore, I say it's a very big difference treating somebody with scoliosis versus treating someone's scoliosis. So therefore, we always recommend seeking treatment for what's causing the problem, which is the size of curvature. And curvatures can range widely in severity from mild to moderate to severe and very severe. And like I mentioned, it is a progressive condition. So it's in its very nature to worsen over time. And as the curve becomes more severe, so will the effects it has on balance and the body. Posture changes, pain, changes in balance, gait become more overt alongside how big the curve becomes. And this really gives the importance of proactive treatments that can come in early in the diagnosis and early in the progressive stage that can have a minimizing the effect of scoliosis, which includes disruptions to balance. And in most conservative approaches, no treatment is actually offered until curves become severe enough to consider spinal surgery. So they really don't offer anything to help patients deal with these effects at early stages until they become severe enough to consider surgery. And once you have spinal fusion, you can have many different effects to balance and coordination because you're fusing and putting rods up and down the entire spine. Where in a conservative realm, we can treat scoliosis much earlier in the progressive nature or progressive stages of scoliosis because our treatments are not nearly as invasive. And since they're not so invasive, we can treat in a much smaller size because I'm not putting rods and screws in the spine that eliminate motion and mobility. You have to wait for curves to become a severe standard before you can consider that type of treatment. So when we look at managing a scoliosis, we know scoliosis doesn't just affect the spine. It affects the entire body. And the way it affects the entire body can definitely affect changes to balance and coordination, leading to uneven forces. So treatment that only works on the symptoms but doesn't work on reducing the size of curve itself, I believe are not 100% effective in really trying to get the results that most patients want. So most patients are looking for addressing the cause of the problem, and this is normally reducing the size of the curvature itself. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.